Okay, we show you now how to treat a scar with the EpiFlow tape. We will look now into the healing of a scar quickly, into the different phases of healing. As soon as an accident happens or the wound is formed after a trauma, we get the inflammation phase. This is the first of the 3 phases, which takes up to 5 days. We get the inflammation signs, and in this phase we first get a vasoconstriction, which means blood coagulation is going to form to prevent the wound from bleeding. Secondly, we have the vasodilatation, which is really important to get more permeability in the skin. We get a swelling to make sure that the second phase can take place. The proliferation phase, which is the second phase, which takes place from day number 5 up to 2 weeks, granulation is formed. The scar closes with a really thin layer of skin. The tissue which is formed is the collagen type number 1. It's a really soft skin. It's still really red, and you have to be careful that you don't hurt yourself. The third phase, the maturation phase, which takes place from 2 weeks on, is the phase where the collagen type number 1 is replaced by collagen type 3. And we have seen that an early scar mobilization can significantly improve the elasticity of the scar, the nerve supply, and also the visual image. And we will treat the scar with the EpiFlow tape. So we make sure that when I measure the tape, that we overlap the end of the scars. You can see really nicely in the back where you want to measure. Okay, we measure first. Cut the edges off. Remove the middle backing paper. You can obviously imagine scars all over the body. This is just now an example.
I might just gonna go around the treatment table to support my arm.
Always important that the patient is comfortable. So no pulling, just gently rub it a little bit. Now we can start our treatment. We make sure that you leave a little bit of space. So we say 1 finger, so you don't just pull the tape off. You want to get that lifting effect. And it's the same effect. You're going to lift and then draw circles clockwise and anti-clockwise along the activation flap. The patient will feel that there might be areas more restricted or less restricted.
Definitely already, yes.
Yes. And then I would like to ask Anne to do it herself.
And the nice thing is that the patients now have the opportunity to really treat themselves at home. And in our experience that we made with the EpiFlow so far, is that we recommend 3 times a day, 5 circles clockwise and anti-clockwise throughout the whole length of the tape. When we think about treating a scar, we always have to think about the mental issue, I think. No matter where the scar is located, we have, for example, experience with the cesarean scars. And the fact that the women really think about the area where the scar is again, that they treat the scar, they can do something, their own responsibility
Yeah.
to not only make it feel better, but to to have a better look on the scar, no matter where it is on the body. And maybe you could say something about the recommendations of how often or
Yeah, like you
use the
said,
tape?
we do it 3 times daily, 5 circles clockwise and anti-clockwise, and you leave it on for 5 days maximum.
Yeah, and after the 5 days, you would
You remove
skip
it.
2 days
Yeah.
and just doing your normal skincare, and then you would use a new tape again on that area which is treated.